Hello, my name is Evelyn Fox, and I'm going to record a video of Thoro-resp respiratory assessment on my son. We're going to get consent. As always, I need you to give consent. The video that we'll record will be used for grading purposes only. My professor will be the only one who views the video other than myself. Is it okay if we proceed with the video?
That's fine.
All right. Okay, well, let's begin. I'll begin the assessment by observation, inspect. I'm looking at, first I'm gonna look at your AP ratio, your anterior, posterior, versus transverse ratio. 1 to 2 anteriorly, and from the back the same. One instance where the anterior posterior ratio would be greater is if you were COPD or you had some sort of pulmonary disease and your chest was enlarged, and your ratio would be off. So it's 1% to 1 to 2. And I'm also assessing, looking at your skin at the color. It's brown, normal for ethnicity, no abnormalities. You don't have any surgical scars, no masses. I don't see any signs of cyanosis. Your skin is dry and warm. Lips are pink. I'm gonna look at your nail beds. Cap refill. Brisk pink. And no abnormalities. I'm also assessing your respiratory rate. Your respiratory rate is normal. Your breaths are normal. There's no retraction around the subclavian or substernal, abdominal oblique, or intercostal spaces, which would be indicative of some serious respiratory distress. I don't hear any adventitious breath sounds anteriorly or and posteriorly. Your lung expansion and the movement of your chest and thorax is symmetric. Next, we'll move to palpation. For palpation, we do what we call the lung or respiratory excursion. It assesses for chest expansion. So for this exam, I'm going to put, it's anterior and posterior. I'm going to squat, so I won't be in the way of the camera. So I'll put my hands here. Take a little skin. I'm going to ask you to inhale it as deeply as you can, and I'll watch the normal expansion of the area. I'm looking for symmetry. Okay, inhale. Okay, exhale. Great. Very good. Okay, I'm gonna ask you to turn around. I'm gonna do the same thing in the back along the 10th rib. Okay, I'm gonna ask you to take a deep breath. Okay, and exhale. Very good. Our next test will be tactile firm test. We'll just start from the back since you're already in this position. This test is a test where we assess for vibration. It's a great test to use to assess for lung consolidation or any abnormalities with the lungs or the movement of air in the airway. When I touch your back, every time I touch your back and I lift my hands and touch it again, I want you to say 99.
99. 99. 99. 99. 99.
All right. A positive, I want you to actually turn around to the front, so I'm gonna do the same thing in the front. A positive, tactile affirmative test, I told you would be indicative of some, lung infiltrates or, pleural effusions or something of the sort. I'll start here.
99. 99. 99. 99.
Okay, good. Okay, so now we'll move on to percussion. I'll start. What I want to hear over the long fills are sounds that we identify as resonance. I'll start here. I'll hold you back. Here, you back a little bit. Thank you. And I'll move in what we call a ladder formation and comparing from side to side. Go down to the second and across the space. Have to be careful to listen between the intercostal spaces, because if you tap on top of a bone, then you'll get, I'm gonna do the lateral for the lower lobes. The anterior lobes are located up here, up into the fourth sternal intercostal space, and then on the right, the mid lobe is there. You're still all anterior here on the left, and then down on the sides, lower where you see me tapping the mid axillary on the sides are the lower lobes. There it is. Okay, now turn around. We'll do the same for the back. Feeling for the you don't tap along the scapula, because resonant throughout. Next, I'm going to going to turn back around. On the front side, I'm going to palpate the costochondral connective tissue that lines the border of the sternum, or what we call the breastbone. I'll just palpate this area for tenderness. And you're negative for tenderness. Resonant throughout all fields of the lungs. And the next thing I'll do is an auscultate. I'm gonna begin by also take the lung fields with the diaphragm of the lungs, and every time I place the stethoscope on your body, I want you to take a deep, slow breath. Sorry, I had turned it on. Okay. Deep breath. Okay. Hold your head up for me. Okay. 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 I don't want you to hold it. I just want you to breathe slow and let it out. Okay. Exhale. In. In. Okay. Turn around to the back. Sorry. Yes, I'll stay on this side. Oh, let's see. Okay, deep breath in. Clear. Okay, clear. 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 Deeper. Okay. Deep breath. Once more. Okay. Okay, since we turn back around to the back, I'll perform the diaphragmatic excursion. This is a test that also, let me get my pen, sorry. I'll put a little mark on your back. This is my thing. Okay, I'm gonna place my hands like I did before. At the 10th intercostal spaces. And I am going to, I'm gonna tap from the top from where I hear resonance to dull, and I'll make an indication. So I'll start about here because I know for a fact that lung feels here. I hope I'm not blocking the camera. I probably should get to the side. I'll do this side since it's steep so she can see me. Resonant. Resonance. 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 Dull. Okay. I want you to inhale and hold your breath until I tell you to exhale. Deep breath. Okay, exhale. Okay, now this time I want you to take a deep breath and exhale and hold your exhaled breath. Don't inhale anymore until I tell you to inhale. Exhale all the air out. Okay, let's measure that. That distance is 3.5 centimeters. This is a test that will be performed bilaterally, but for recording or educational purposes, we're only going to do one side. Everything is fine. Your lung fields were clear throughout. No, you turn around. No adventitious breath sounds like rhonchi, rails, stridor. The trachea is midline. I forgot to mention that earlier. And everything is healthy and well. And this ends our assessment for thorough pulmonary examination. Thank you.